the next thing that we really need to help Americans understand is it's not so good for his mother either. The complications are a lot higher than we recognize physically. As far as mental health complications, high quality studies out of European countries, which have much better data than we do, tell us a woman is 6 times as likely to commit suicide in the year following an abortion than if she had given birth. So many of these women live to regret this decision and often take an action that ends their life. And then many others suffer from anxiety and depression, self-harm, substance and alcohol abuse. So it injures a lot of women, and it's injuring our society.
Thanks for checking out Culture Proof. I'm Miki.
And I'm Will.
And today we are having a very important conversation about the lies that are taking lives in our culture. And we'll talk about why this is important, especially as we are just a little bit less than 2 weeks away from a national election that has huge implications. I think every Christian needs to listen to this podcast episode and then be to share it. We're going to be talking about a life issue. One of the things that I'm aware of is that when you look at the Harris and Walz campaign, the Kamala Harris campaign, the polling numbers seem to be really good for her among women who are pro-abortion. And you can call that pro-choice, you can call that reproductive rights, but when you get down to it, you're talking about they are pro the taking of innocent life. Yeah. And so I think if that's a margin that you can even look at and measure and say, well, here's where they're doing well, we have a problem. It also tells me that we may have some problems in the professing church, that those numbers can be where they are. So we're going to talk a little bit about that today. Before we get into our conversation and welcome our guest, I want to say thank you to BJU Press Homeschool. BJU Press Homeschool makes it possible for us to have the kind of conversation that we're going to have today. Not an easy conversation, but a necessary conversation. They also make it possible for us to homeschool our kids with confidence. We're homeschooling parents of 6 children, and we do that because we take very seriously their discipleship. We want biblical worldview woven into every aspect of their curriculum, and BJU Press Homeschool makes it possible. You can check them out by going to bjupresshomeschool.com. That's bjupresshomeschool.com. Let them know that the Addisons sent you. We're going to get right into content. Our guest is Dr. Ingrid Skop. She's a board certified OBGYN. She is the vice president and director of medical affairs for the Charlotte Lozer Institute. And she joins us to talk about the Harris-Walz campaign and the lies that we see coming out of this campaign that I'm sad to say, also have an effect on voters, because you see that Harris and Walz tend to be doing well among those who are pro the taking of innocent life. But there was a ProPublica article that I read in September. We talked about it a little bit on the Culture Proof podcast that kind of made Amber Thurman, a woman who tragically died in a botched do-it-yourself abortion, if you can imagine that we're living in that time. But she became sort of like a rallying cry for those who would say that pro-life laws that are designed to protect women, are actually killing women. Dr. Skop is joining us today, and she's going to help us make sense of, well, I don't know if you can make sense of lies, but she's going to tell us the truth about what's going on. Dr. Skop, thank you so much for joining us. Could we just start by kind of introducing yourself to the Culture Proof audience and telling us a little bit about your medical background?
Thank you. I am so glad to be here with you guys today. And as you mentioned, I'm a board certified OBGYN. I've been practicing in Texas for over 30 years. Love my job. Love the fact that I have 2 patients, a woman and her unborn child, and I advocate for both of them. I grew up in a pro-life family, so I am the oldest of 6 children. My family love children, and I actually was what brought my parents together in marriage as an unintended pregnancy, even back then. So I've always advocated for life, but as an OB-GYN, I have seen so many women who've been harmed by abortion. And that's why I speak out, not just on behalf of the unborn child, but on behalf of his mother as well.
You know, I'm wondering, why is it that we are now, more than probably we ever have had to do, we've got to put a distinction on sort of the OBG position, like we say a pro-life OBGYN, you know, or we just say she's an OB. Why are we doing that? Are the majority of practicing OBGYNs, are they pro-life, or are you an anomaly these days?
To be an outspoken pro-life OBGYN is certainly an anomaly. It's really hard to know what people think personally. Of course, we all recognize, because the ultrasound technology is so amazingly intricate, we all realize we are taking care of another human being from the moment of fertilization. But unfortunately, many of the mainstream medical organizations do have I would say a pro-abortion bias, to be perfectly honest, because we see them attacking crisis pregnancy centers. We see them attacking interventions like reversal of the abortion pill mifepristone. So really, it does seem that in many cases, they don't want women to have the choice to continue their pregnancy and bring their child to birth, which is so ironic because we are the doctors who care for women. But to point out a couple of things. One is that approximately 90% of obstetricians do not perform elective abortion. So we're kind of voting with our actions, saying we don't want to end unborn human life. But at the same time, our professional organization, the American College of Obstetrics and Gynecologists, has gone on the record saying no restrictions, no limitations, no barriers to abortion at any time for any reason in pregnancy. Unfortunately, I think this is a very eugenic ideology. There may be other reasons for it as well, but this is, it's disappointing. But what does the average OBGYN think about this? We don't know, because our professional society has not asked us how we feel about their abortion advocacy.
Man, we're at a point now, and I was looking at this during the conventions that were being had, where abortion is a frontline issue, for the Democratic Party. And it's amazing to me because even in the past, it was like, the economy, things like that, a lot of identity politics and stuff like that. But now it's abortion, and they were not ashamed to say this is what we're standing on. How do you think we get to this point where it's so overt and so blatant, the love for killing the unborn?
Well, I think at its root, it's a spiritual issue, and I think we should all recognize that. But I think that is very informative. It's been suggested that Kamala Harris has very few policy statements that she's really laid out. The only thing we know for sure about her is that she wants absolutely no restrictions on abortion. And that is not in line with what the American people believe. When we look at polls, we see at least 70% of Americans feel that abortion should be limited to no later than the first trimester. But in many cases, they feel it should be completely limited, all elective abortions. So, I think the only way that they can put forth the narrative that this is a winning issue for them is the fact that the American public have been gaslighted for so long. They truly do not understand the issue. And like you said, and I'm sure we'll discuss in some detail, they're lying about the laws. And so they're misrepresenting, they're causing fear among the American public, among pregnant women, and among obstetricians, because they have so misrepresented the laws that, unfortunately, many people do not understand what the laws allow and what they don't allow. And going back to the medical organizations, doctors are not attorneys. We don't really understand new laws that are put forth that govern the practice of medicine. We rely on our professional associations to help us understand the law. But because so many of the organizations are pro-abortion, they have remained silent. In fact, sometimes they've stirred up the fear and confusion themselves, but they certainly have not helped the doctors understand in what circumstances they can intervene and when they cannot. Every law, by the way, allows an exception if an abortion is needed to save the life of the mother. So we should not be reading about women who've been harmed by doctors refusing to intervene when they've had life-threatening pregnancy complications, because understood correctly, these laws all allow an intervention if the doctor feels it is needed.
Dr. Skop, you've touched on something here that I think is so important, and it may be a little bit uncomfortable, maybe for me, just sort of as a lay person, as a person who I've given birth to 6 children, and I trust and believe that my OB, when I go into my office, my doctor's office, I trust that she knows what is best, right? That she has an idea of how I'm going to be best served. But you just touched on something that I don't think we talk about enough. Like when we talk about a doctor and we talk about the scope of that doctor's profession, what that doctor knows, and then you just kind of like compare that to being an attorney and what that doctor understands about the law. That has nothing to do with the doctor being, informed in his or her area or his or her profession. But when we start talking about the laws, not understanding laws in this country could be deadly for women. And I think it's not made any better by the proliferation of lies that surround the laws in this country. Recently, you've heard talk of Trump bans, right? I mean, that is just absurd to think about. Like, where is there a Trump ban on abortion? But you hear these things, and I don't think that I've ever considered that our doctors, our physicians would be taking these lies into consideration and then acting in accordance with those lies. Talk a little bit more about that.
Yeah, it is so tragic. So I think that there are several things that may be happening. Again, it almost appears as if many of my peers have not even used Google to read the law, because the laws are usually quite straightforward. They will say something like a doctor may use his reasonable medical judgment or his good faith medical judgment, which are standards that we've always abided by. These are not new terms made up since the overturn of Roe v. Wade. Basically, this means standard of care. This is the same criteria that is used in deciding a medical malpractice case. And by the way, obstetricians, as you may know, are the medical specialty most often targeted with medical malpractice allegations. So we have been brave in the past, but unfortunately, what we're seeing is this lack of guidance. And then they read these articles like the ProPublica article that you mentioned, which states falsely that Georgia made a D&C illegal. No, of course, that is just a procedure. What Georgia did is it said you cannot electively end an unborn human life when you can see that heart beating. Now, as we all know, if that life has tragically already ended through a miscarriage, or in the case of these women that we'll discuss, they had taken the abortion drugs and had failed abortions, and they needed a D&C in order to remove the dead tissue that their body had been unable to expel. Of course, that's not illegal. That is common sense that in that case, that procedure was needed. In both of these women's case, because they were suffering complications from these drugs. So again, just so dishonest to try to conflate a procedure with the intent of the law, which is to protect unborn life. And likewise, when we read that doctors are failing to treat miscarriages, that is absolute idiocy to say that a doctor can't treat a life that has tragically ended when these laws aim to protect life from being intentionally ended.
Dr. Skop, I think about a lot of our mainstream media, and I think of a lot of our politicians, and I am sad to say that they are almost masterful at their ability to create a narrative around a person, to humanize an issue for bad, for evil. With ill intent. And they have done that around Amber Thurman and Candy Miller, 28-year-old Amber Thurman and 41-year-old Candy Miller. Can you tell our listening audience, our viewing audience, a little bit about these two women and why they are recently in the news, and how the liberal left have created a narrative around these women that ultimately will be deadly for other women who are listening in?
Yes, absolutely. I mean, these are tragic, heartbreaking deaths. And both of these women leave behind children. They were both Black women. And I would say, as an aside, that Black women are overrepresented in maternal mortality in our country, approximately 3 times the rate of white women. But also, it should be noted, they have 3 times the abortions. Abortion is not protecting them. And for many reasons that I've written about on our website, I think that there are things that are putting them more at risk because they are so often abortion is promoted to them as a solution to the problems that they are having. But both of these women obtained the abortion drugs mifepristone and misoprostol. In Amber's case, she became septic. She had a life-threatening infection. And by the way, the FDA maintains a black box warning on mifepristone, alerting doctors to the fact that this rare sepsis can occur and it can very, very quickly kill a woman. But despite that, when she finally did present to an emergency room, it took the doctors 20 hours to decide to intervene surgically, and she died on the operating table. I don't know why the doctors did not take action sooner, but it had nothing to do with the Georgia law because, as I mentioned earlier, this was just dead tissue that needed to be removed. It had nothing to do with protecting unborn life. The second woman, Candy Miller, also obtained these drugs. And by the way, she was able to order them online and have them delivered through the mail from the Netherlands. So that obviously is and should be illegal, but our current government has no desire to prevent that sort of abortion drug being used in a totally medically unsupervised way. She also suffered a failed abortion. It's not exactly clear, but she had toxic levels of fentanyl in her system. I think probably she was having such severe pain from her failed abortion that somehow she was able to obtain and take fentanyl. Her family says that she did not go to see the doctor because she was afraid she would be prosecuted. This is a clear example of how these lies around the laws are harming women, because no law in any state will prosecute a woman who obtains an abortion, even if abortion is illegal in the state. Because, of course, we do consider these women to be a second victim of abortion, because in so many cases, our country has been lazy. We've not addressed the real reasons that women seek abortion. We've merely for 50 years offered them abortion as the solution rather than pursuing real solutions. A couple other things I want to say. The FDA removed all of the in-person safeguards on these drugs long before the overturn of Roe v. Wade. So the fact that she was able to get those drugs through the mail, that was made possible before the overturn of Roe. So again, there's absolutely no link to Georgia's abortion law. This was the plan all along for women to obtain medically unsupervised, dangerous abortion drugs. And just to show how politicized this whole process is, everybody knows Amber Thurman's name, but very few people have heard the name of another young woman, Aliana Dixon, who also died of this rare sepsis after having a failed mifepristone misoprostol abortion. Why are we not talking about her? Because she died the same year in Nevada. There was no pro-life law to blame in Nevada, so she has not been useful to the narrative, even though she tragically also died and left behind a child from this known complication of these dangerous drugs.
Wow.
Oh my goodness. It just goes back to what I was saying. They are masters at creating a narrative and, kind of conjuring up the emotions that you are told to feel. Like you are told these are the emotions that you're allowed to have in our culture surrounding a particular conversation. And it's being shaped by those who don't have any fear of God in their eyes. I'm hoping, Dr. Skop, that you can help us understand some of the medical background here. Like when we talk about Amber Thurman and we talk about Candy Miller, describe for us what sepsis actually is. And then out of that, if you could help us understand how we could have these known side effects from these, box shipped abortion pills, how we can have these known side effects, but still also have this public narrative that these drugs are safer than Tylenol. How do you reconcile those things when we know that they are, and we know that women are dying?
Yes, thank you for asking. So mifepristone blocks progesterone. It kills the unborn child, followed by misoprostol that induces labor to expel the pregnancy tissue. And as you said, the abortion industry narrative is that these drugs are safer than Tylenol. The very first thing to understand about abortion in our country is we essentially collect no mandatory data.
Mm.
So we don't even know how many abortions occur because we really don't want to know the answer. We see the CDC reporting one number. We see the Guttmacher Institute that gets their information directly from abortionists reporting a far higher number every year. We don't know the complications. The abortion industry will tell us the complications that they know about. That's what gets published as approximately 1 to 2% complications. But you know what? In their studies, generally between 15 and 50% of the women they've sold the drugs to, they have been lost to follow up. They do not know the outcome. So when you look at more high quality study, which we've published at Lozier, and this information for those who are interested is on our website, you discover that after these drugs, approximately 5% of women go to an emergency room. Approximately 6 to 8% of women need surgery to remove that tissue that their body is unable to expel. And we see that complications are 4 times as high after these drugs compared to surgical abortions. So if the abortion industry really cared about women, they'd be offering surgical abortions, and yet increasingly they're promoting these drugs. It's easy for them. They give a woman some pills, she goes out the door, she deals with and manages her own abortion. And then, like we said, the FDA, they're abdicating their duty because they've removed all of these safeguards that would even make a woman go in and be evaluated before the abortion. So right now there's no pre-abortion testing, no ultrasound to rule out an ectopic pregnancy, no labs to determine if a woman needs ROGAM to prevent future pregnancy complications, no informed consent. They're ordering these on a website. Do they know there are 2,700 pregnancy centers that would love to walk alongside them if they want to give birth to their child? And our studies have shown that the majority of women with a history of abortion say they would have preferred to give birth if they'd only had more support. So all of this is going on. By the way, a group of pro-life doctors took a case to the United States Supreme Court last term, asking the court to look at what the FDA has done and to provide and to require them to do their job to protect us, the women, from dangerous drugs. And sadly, the Supreme Court sidestepped the issue entirely. They said that the doctors did not have standing to bring the lawsuit. This comes in the wake of Planned Parenthood has always been granted standing every time they've wanted to bring a lawsuit against a state's abortion law. So we can see sort of this two-tiered playing field that we're on. The abortion industry is granted immense credibility, even though they are falsely telling us that these complications are far lower than they actually are. And then they're selling these drugs to women, and women are going through this horrible experience alone. And sadly, also, I do want to say so many of these women will see their child and know what they've done and realize that this was not just a clump of cells. This was clearly identifiable as a human being. And we are having an emotional and mental health crisis in our country. And I just can't imagine how much worse it's getting that so many women are going through this horrific experience.
Well, I would have to say, just listening to everything that you're saying, I'm convinced that the general public does not have all the information. And so if you can get people just to be in their feelings and to see people and say, oh, this is what happened, and not really understand really what happened, I can see how, a population can be swayed into that direction. And it highlights the need for this information and to know what's really going on.
Yeah, it's the height of a lack of love. I'm aware of the details, a little bit of the details. I want to throw those out to you, Dr. Skop, and just kind of get your take on it as a medical professional. But you have Amber Thurman, who is 9 weeks pregnant, if I'm recalling the details correctly. She travels from Georgia to North Carolina to get an abortion. It was supposed to be, if I remember, an in-clinic abortion, right, and she was late. And at the height of the love that the clinic demonstrated for her, they threw some pills her way and sent her home. I just don't understand how we are able to skirt the reality that is unloving to say, hey, okay, yeah, you're late. We can't get you in. By the way, here's some drugs.
And
go
was she
home.
Not pregnant with twins?
She was pregnant with twins, 2 children, 2 babies. So when she presents herself to a Georgia emergency room, she is suffering from sepsis. What is that? And what, in your medical opinion, I know you were not acting there as a physician, but in your medical opinion, what should have happened with Amber Thurman when she went to the emergency room and she's got these symptoms where there's, bloody discharge and odor and probably fever and immense pain? What do you start thinking as a board certified OBGYN?
Yes, thank you for letting me follow up on your previous question. So yes, she did have twins, and we know that that means she had double the pregnancy tissue in her uterus. So her risk of failing at that time, just knowing what they knew, she was at much higher risk to fail. And yet, of course, like you say, they just gave her the pills and sent her on her way. As the ProPublica article describes it, she actually was at home for a while suffering from her complications and was brought to the emergency room because she passed out at home. That means her blood pressure was low, which is a sign of sepsis. They also described that she had uterine tenderness and foul smell, and that it was known that there was pregnancy tissue still in there. So independent of any law, even a third-year medical student knows if you have infected tissue and someone and the sepsis means that the infection had gone into her bloodstream and was threatening her life. So this, we know from the article, was the case when she walked in the door of the emergency room. And we all know, in order to adequately treat that infection, you've got to remove the source of the infection. So IV antibiotics are not going to get into that dead tissue. It must be removed from the uterus. Very straightforward procedure, D&C, just suction to remove that tissue that her body was unable to expel. That should have been just a knee-jerk reflex from any doctor in our country to immediately take her to surgery. So again, the fact that she waited, that the doctors waited for 20 hours. I have seen an interview relating that her attorneys believe this was medical malpractice. And certainly from the outside, this does look like medical malpractice, because any doctor should have known that the very first step was to remove that tissue that was the source of the infection, and that likely would have saved her life.
And the removal of that tissue would have required a D&C. Describe that procedure for us and help us to understand why this does not violate, and you alluded to this earlier, but this doesn't violate any law on the books anywhere, that in order to save a mother's life, that a doctor or an emergency room attending physician would not be able to perform a D&C. What is that? And help us understand the process.
Yeah, so a D&C, dilation and curettage, really more accurately, we would describe it as a suction aspiration, is a very minor surgical procedure where, as the name describes, vacuum suction is just used to remove that tissue from inside of the uterus. Doesn't require incisions. It's just, suctioning through the open cervix. And D&Cs are used for many, many different gynecologic indications. So we could use it for postmenopausal bleeding. We could use it after a delivery, perhaps if some placenta was retained. We can use it in Amber's case to remove tissue from an early pregnancy loss. And of course, a D&C can be used to intentionally end that unborn human's life. But in Amber's case, it seems pretty clear that her twins had already died. They had died as a result of intentional feticide by mifepristone and misoprostol. But because all of the dead tissue had not been expelled, that's what needed to happen. And of course, no law is going to prevent that. But the ProPublica article lied and said that Georgia had made a D&C illegal. But as we can see, it wasn't the procedure that was illegal. It was only using that procedure to intentionally end human life that was, and I should say in Georgia, human life that demonstrates a heartbeat is what their law says specifically. So that was not the case. There was no reason that anyone should have hesitated to do the surgical procedure that was needed to save Amber's life.
It's amazing to me, Dr. Skop, that, when I listen to those details and I listen to you talk about what should have happened, at least in the case of Amber Thurman, I can't help but think about that being sort of like the picture of injustice. We talk about so-called reproductive justice and we talk about the rights of women. But I'm thinking if people really cared about women, if the liberal left really cared about women, if Democrats really cared about women, then the story would not be the so-called Trump bans. The story would be, hey, what happened when she presented at the emergency room? Like, where was the disconnect? What really was the injustice that she suffered? And I would say, I would go back so far as to say that the injustice began with the lie that she could just go home and take these pills and just walk away as if nothing happened. And that is the lie that's being propagated, I would say, in many homes in this country, even those where Christ is named. There's just so much misinformation and disinformation that I think you've got a lot of Christians who don't know how to think biblically on the issue of life. Can we talk a little bit about how you are a pro-life OBGYN? How have you arrived at that position? And what might be some takeaways for some of our listeners who are struggling to understand it?
Well, as I mentioned, I love the unborn child. That's what drew me into obstetrics, is just from seeing him on ultrasound at a very early age to seeing him come forth out of his mother into our world. And I come at this from being in a pro-life family, but also being a Christian and recognizing that the Bible does speak to this issue quite a bit. Interestingly, there was a Barna survey a couple of years ago that demonstrated that about 44% of Christians felt that the Bible was ambiguous about abortion. And to me, this is saying that there are so many Christians in our country who do not pick up the Bible to read it, because it is full of information that tells us that God made man in his own image, that he lovingly crafted and knit together the unborn human in his mother's womb. And it tells us that we should rescue those being led to the slaughter. Clearly, with 1 million abortions last year, that is the class of human that is being slaughtered indiscriminately. So as Christians, we should recognize this is a human being that is worthy of our attention and our advocacy. Amen. And, I think we all recognize, if you're outspoken, you will be attacked in today's world. And so when I read further in the Bible, I recognize Jesus told us that. He said, if they hate me, they will hate you. And he told us over and over again, do not be surprised when you are persecuted as if something unusual is happening to you. And so this gives me, don't Google me, because there's a lot of people who don't like me, but this gives me hope every time I am attacked, because I say, I must be speaking the truth, that there is so many attempts to discredit me. So it just makes me speak all the more. But Christians do need to pick up their Bible. They do need to recognize, and the science goes along with this. There is nothing controversial about the scientific fact that at the moment of fertilization, a new human being comes into existence. He is alive. He has his own genetics. He will become he already is a unique human being if he's allowed to come to birth, who will never be duplicated in our world. And so even when we see, a lot of pro-choice people will say, well, I'll acknowledge that, but his mother's life has more value, or he's not a person yet, which of course is a philosophical question. That's not a scientific question, when his life has value. But I think the next thing that we really need to help Americans understand is it's not so good for his mother either. The complications are a lot higher than we recognize physically. As far as mental health complications, high quality studies out of European countries, which have much better data than we do, tell us a woman is 6 times as likely to commit suicide in the year following an abortion than if she had given birth. So many of these women live to regret this decision and often take an action that ends their life. And then many others suffer from anxiety and depression, self-harm, substance and alcohol abuse. So it injures a lot of women, and it's injuring our society. It's made so many men feel her body, her choice, not my problem. And we've seen so many fathers walk away. We've seen prior to Roe, about 1 out of 10 women gave birth outside of wedlock. Today, across the board, it's 4 out of 10. So we're seeing more single moms, more children being raised without a father, often living in poverty. Those are all direct effects of the fact that we have stopped protecting this unborn life, that there is a class of human targeted for genocide whose life we have said does not matter. And
Mm.
this is harmful for society as a whole. And as I mentioned earlier, there's so many ways we can help women with the problems that they're facing so that they can bring their children to birth. And of course, it remains unsaid that there are very effective contraceptive methods. If someone really does not want to have a child, then they can take action before conceiving a child in order not to do so. So, we've gotten lazy. 50 years of widespread abortion on demand under Roe led us to having the worst maternal mortality rate in the developed world. So it's not helping women.
Wow.
Women are still dying. And, I think that in some cases, we can link back to abortion, and which can predispose women to future pregnancy complications and many other things, single moms and poverty, that we know are directly linked to maternal mortality.
I really am convinced that at the core, like the fundamental issue that we're discussing is a worldview issue, and whether or not a person has a biblical worldview or a man-centered worldview. I think when you hear some of the arguments, like you think just at sort of like the local level, the conversations, at least that I've been a part of, and we've been in public service for a long time, you think about some of the people who would call into our national radio show and say, well, what do you do with a person who, the life of the mother or the child was raped? I remember we had one person actually call in to our radio show. We've got 2 teenage daughters, and said, what would you do if your daughters were raped? And my question was, is the baby not human in that instance? Like in that particular case, are we then talking about somebody who is less human because of the way that child was conceived? And I think there are a lot of Christians who won't be honest, Dr. Scott, but really there is not a biblical worldview in place. There's no fear of God in our eyes. If you're having a conversation about the humanity of a person based on the means by which that person is conceived. And I think the liberals have really seized upon that. They have capitalized on that, and they continue to tell these stories, and they continue to push these narratives that really almost, I think, make the Christian ashamed to stand up and say what we believe, that a life is a life is a life, and that God is the author of that life. Kind of as we wrap up here, how do we get back to a place where we are able to stand flat-footed, unashamedly on the word of God? Because that's the issue here. I mean, yes, there may be a biological conversation that we're having about when life begins, but I don't think in sincerity that's where the conversation is. I think the conversation fundamentally is one of a biblical worldview.
I agree. And I think that the very first place that we need to go is we need to open up the Bible and see what it has to say. We need to educate ourselves on what's really happening. That's why I'm so happy that you had me here today, so that people know about Losier, loserinstitute.org. We've written on all of these issues so that people can really understand what is really threatening women and how does abortion hurt women, which we've documented extensively. But as you said, they do a great job of painting a picture of tragic circumstances. Americans should understand that more than 95% of abortions in our country are healthy moms and healthy babies. So, and as I mentioned earlier, every law allows an exception if an abortion is needed to protect the life of the mother. In 30 years of practice delivering over 5,000 babies, I've never had to do a direct abortion to save a mother's life. There have been times I've needed perhaps to induce labor, prior to a time that I knew a baby could survive. My intent was to protect the mother. Intent is very important. My intent was not to directly end that child's life. So I would argue that's never needed to directly kill the baby in order to protect his mother. But yes, we just need to come back to a biblical understanding. Unfortunately, so many of our pastors will not address this issue from the pulpit. And so we're kind of left to form our own opinions. And really, of all issues that pastors should be engaging in, particularly with the lies that are going around, this should be an issue that they should discuss, notwithstanding the fact that approximately 17% of Christians sitting in the pews have a history of abortion. So not only do we need to be prepared to know how to vote, to know how to discuss this conversation, but there are people who probably still have a raw wound that has not been addressed by their pastor. And so they may even think that this is a sin that God can't forgive. So, obviously there's so many reasons that the church needs to be addressing it. And again, if pastors are attacked by it, if the government threatens to take away their tax exempt funding, well, if they persecuted Christ, they will persecute us. And so we're not here to live a comfortable life. We're here to advocate for the things that God finds important. And we know that the unborn child is something that's very dear to his heart. And so as Christians, we should all wake up and recognize, I need to know what's going on and I need to speak about it. And I think if the church woke up and started talking about this, we'd see a whole different political conversation. But again, it's not a political issue, it's a spiritual issue. So thank you for highlighting it today.
Oh man, it's beautifully said. What you just said is beautifully said. And my goodness, I hope that it's an encouragement and a challenge to members of the Lord's body that we would stand up and start talking about these issues, and to pastors as well.
Specifically, to talk about it and not be afraid of the backlash, because you're standing on the word of God.
Yeah.
And so these things have to be addressed, because I agree that there are people in those congregations who have had abortions and still suffer from, just the thoughts of doing that. But that they can, if the pastors would be bold enough to speak out about it and to show what the word of God says and to minister to those folks, man, I think we'll see a lot of changes.
Yeah, Dr. Skop, let me just say, we appreciate you. Thank you for what you're doing. Thank you for doing that. Also identifying, everybody's talking about their identities, identifying as a Christian, right? Like that it's a biblical worldview that shapes and drives and informs the public position that you're taking on issues that, yes, they are private, but they have been brought out into the public and they do have eternal implications. Thank you so much. You are board certified OBGYN, vice president and director of medical affairs for the Charlotte Lozier Institute. And I want to direct our listeners to check out your website. Is it lozier.org?
It's LOZIER institute.org.
LozierInstitute.org. Before we let you go, I'm curious to know, as a Christian, what are you reading right now in scripture that is teaching you, training you, maybe rebuking or correcting you, kind of equipping you to stand for the Lord these days?
Well, I always like to go back to the book of James to learn how to not just have faith, but to have faith with action. And it speaks so much about the tongue, about what an instrument the tongue can be for destruction or for good. And so it's encouraging to me to recognize that we can use our voices, and it's very important to use our voices for good, not just to have a personal faith, but to have a faith that has outward action. And I think that's what the American church needs right now is to look different, to be salt and light, and to look different from the surrounding culture.
Oh, awesome.
Thank you. Thank you so much. What an encouragement. What a challenge to all of us, our faith action so much. Dr. Ingrid Skop, we appreciate the time you've shared with us this morning. Thank you.
Thanks. It's been great to be with you.
When we resist those cultural trends that rival the truth, we remain culture proof. Until next time, Lord willing.
God bless.